If you have a headache and you need relief fast, the best first move is not to guess. It's to run a quick, safe checklist that targets the most common triggers. In the next few minutes, you'll try steps that are low risk and often helpful before you reach for anything stronger. Start by asking one question. Is this a familiar headache for you, or is it new and unusual? If it's unusual, severe, or came on suddenly, that matters. But for the everyday tension-type headache or mild migraine pattern, the fastest wins are often basic. Hydration, light, posture, and stress signals can all stack up. The goal is to remove the fuel that keeps the pain going. And you'll do it in a clear order, so you're not trying 10 things at once. Let's begin with the quickest safety check. Then move into the steps you can try right away. Moving to slide 2. Before you try to push through, do a rapid red flag scan. If you have the worst headache of your life, a thunderclap onset within seconds, fainting, confusion, a seizure, or weakness on one side, treat that as urgent. The same goes for a headache with fever and a stiff neck, a new headache after a head injury, or vision loss that doesn't clear quickly. If you're pregnant or recently postpartum, a new severe headache also deserves prompt medical attention. And if you're over 50 with a brand new headache pattern, it's worth checking. Most headaches are not dangerous, but this step keeps you safe. If none of those apply, and this feels like your usual pattern, you can move on to self-care. The rest of this guide is about practical steps that are generally safe for most people. Now let's start with the fastest, most overlooked fix: fluids and electrolytes. Moving to slide 3. Dehydration is a common headache amplifier, and you don't need to feel thirsty for it to matter. Start with a full glass of water, slowly, over a few minutes. If you've been sweating, had diarrhea, drank alcohol, or skipped meals, consider electrolytes too. That can be an oral rehydration solution, a low-sugar electrolyte drink, or even a salty snack plus water. The point is to restore fluid balance, not just chug water. Give it 10 to 15 minutes and notice if the pressure eases even slightly. Small improvements are a clue you're on the right track. If plain water makes you nauseated, take smaller sips more often. And if you're on a fluid restriction for a medical reason, stick to your clinician's plan. Next, let's fix the environment, because light, noise, and screen strain can keep a headache switched on. Moving to slide 4. Your nervous system reacts to light and sound more strongly when you have a headache. So reduce the load. Dim the lights, lower the volume, and step away from bright screens for a few minutes. If you can't stop working, try the simplest screen reset. Lower brightness, increase text size, and look at something far away for 20 seconds every couple of minutes. For some people, fluorescent lighting is a big trigger, so natural light or a softer lamp can help. Also check your jaw and forehead without overthinking it. If you notice clenching, let your teeth separate and rest your tongue on the roof of your mouth. That small change can reduce tension through the temples. If you can, take 5 slow breaths with a longer exhale than inhale. Then reassess. Next, we'll address one of the biggest hidden causes of fast headaches. Moving to slide 5. A lot of headaches are really neck and shoulder headaches in disguise. When your head drifts forward, the muscles at the base of your skull work overtime. That can refer pain into the temples, behind the eyes, or the back of the head. Try a quick reset. Sit tall, gently tuck your chin as if making a double chin, and hold for 5 seconds. Repeat 5 times slowly. Then roll your shoulders up, back, and down, and let them stay heavy. If you can, stand and do a doorway chest stretch for 20 seconds to open the front of the body. None of this should be painful. You're aiming for lighter, not stronger. If you feel sharp pain, stop. After the posture reset, many people notice the headache stops climbing. Next, we'll use temperature, cold or heat, to calm the pain signals and muscle tension. Moving to slide 6. Temperature can change how pain signals feel, and it's one of the safest tools to try. If your headache feels throbbing, hot, or migraine-like, many people prefer cold. Use a cold pack wrapped in cloth on the forehead or temples for 10 minutes. Then take a break. If your headache feels tight like a band or your neck is stiff, gentle heat can be better. Try a warm shower, a heating pad on the neck, or a warm compress for 10 to 15 minutes. Avoid extremes and protect your skin. You can also combine approaches: cold on the forehead, heat on the neck. While you're doing this, keep your jaw relaxed and your shoulders down. Then reassess again. If you're getting even a small drop in intensity, keep going with the same approach. Next, we'll talk about caffeine. Moving to slide 7. Caffeine is tricky because it can help certain headaches and worsen others. In small amounts, it can narrow blood vessels and boost some pain relievers, and studies show it may reduce headache intensity for some people. But if you use a lot daily, withdrawal can trigger headaches, and too much can increase anxiety and muscle tension. A practical safe test is a small dose, about half to 1 cup of coffee or tea, ideally with water alongside it. If you rarely use caffeine, start even smaller. Then wait 20 to 30 minutes and reassess. If your headache improves, don't keep stacking more caffeine. If it gets worse, stop and switch to non-caffeine steps. Also, if it's late and caffeine will ruin your sleep, it may backfire because poor sleep is a major headache driver. Next, let's use food and blood sugar stability, another common fast fix. Moving to slide 8. Skipping meals can create a headache through low blood sugar, stress hormones, and muscle tension. If you haven't eaten in several hours, try a small, balanced snack. Aim for carbs plus protein, like yogurt and fruit, peanut butter on toast, or crackers with cheese. That combination tends to stabilize energy better than candy or soda. If nausea is part of your headache, keep it bland and simple, and eat slowly. Also notice if strong smells make things worse. If they do, choose something neutral and ventilate the room. For some people, very salty foods can worsen headaches. But for others, especially after sweating, salt plus fluids helps. The key is to match the context. After you eat, give it 15 to 20 minutes. If the headache is easing, you've likely found a major contributor. Next, we'll do a short relaxation technique that targets the stress-pain loop without requiring meditation skills. Moving to slide 9. Pain and stress feed each other. The headache raises your stress, and stress tightens muscles and amplifies pain signals. You can interrupt that loop in 2 minutes with a simple breathing pattern. Inhale through your nose for 4 seconds, then exhale for 6 seconds. Do that 10 times. The longer exhale nudges your body toward a calmer state. If breathing through the nose is hard, just breathe gently through the mouth. While you breathe, scan for the 3 most common tension spots: jaw, shoulders, and hands. Let each one soften on the exhale. This is not about forcing relaxation. It's about removing extra tension that your brain interprets as danger. Many people notice the headache stops spreading after this. If you have time, add a short walk at an easy pace, because movement can reduce stiffness and improve circulation. Next, we'll cover over-the-counter options, how to use them safely without creating rebound headaches. Moving to slide 10. If you decide to use over-the-counter pain relief, the safest approach is to keep it simple and follow the label exactly. Common options include acetaminophen or anti-inflammatory medicines like ibuprofen or naproxen, but what's appropriate depends on your health history. For example, anti-inflammatories may be risky with certain stomach, kidney, or bleeding issues, and acetaminophen requires careful attention to total daily dose. Avoid mixing multiple products that contain the same ingredient, because that's an easy way to accidentally take too much. Also, be cautious with frequent use. Studies and clinical guidance often warn that using acute headache medicines too many days per month can contribute to medication overuse headache, where headaches become more frequent. If you're needing pain medicine regularly, that's a sign to talk with a clinician about prevention and diagnosis. Next, we'll talk about sleep and the 20-minute reset, which can be surprisingly effective when your body is overloaded. Moving to slide 11. Sometimes the fastest headache fix is a short reset, not a longer battle. If you can, lie down in a quiet, dim space for 20 minutes. Set a timer so you don't worry about time. Support your neck so it feels neutral, not cranked forward. If you tend to wake with headaches, consider that your pillow height or sleep position may be part of the pattern. For a daytime reset, you can also try a non-sleep deep rest approach. Eyes closed, slow breathing, and letting your muscles go heavy. You're not trying to fall asleep. you're giving your nervous system a break from input. If you do fall asleep, keep it short, because long naps can disrupt nighttime sleep and trigger another headache cycle. After the reset, stand up slowly, drink a bit of water, and reassess. Next, we'll cover how to tell what type of headache you're dealing with, so you can choose the right tool faster next time. Moving to slide 12. Choosing the right step gets easier when you can roughly label the pattern. Tension-type headaches often feel like pressure or tightness on both sides, and they pair with neck or scalp tenderness. Migraine often brings throbbing pain, light or sound sensitivity, nausea, and sometimes one-sided pain, though not always. Sinus-related pain is commonly tied to congestion and facial pressure, but many sinus headaches are actually migraine. Cluster headache is different. Severe, one-sided pain around the eye, with tearing or a runny nose on that side, and it tends to come in episodes. This matters because the best self-care differs. Tension patterns often respond to posture, heat, and relaxation. Migraine patterns often respond to dark, quiet rest, hydration, and avoiding triggers. If you're unsure, track 3 things: when it started, what you were doing, and what helped. That simple log can make future headaches easier to manage and easier to discuss with a clinician. Next, we'll finish with a clear plan for when to seek help, plus a simple routine to reduce recurrence. Moving to slide 13. Here's a practical plan you can reuse. Step 1, quick red flag check. Step 2, water plus electrolytes if needed. Step 3, reduce light and screen strain. Step 4, posture reset and temperature therapy. Step 5, consider a small snack and a small caffeine test if it fits your pattern. Step 6, a 2-minute breathing reset. If you still have significant pain and it's typical for you, you can consider an over-the-counter option while following the label and your personal medical guidance. Now, when should you get checked? If headaches are becoming more frequent, changing in character, waking you from sleep, or interfering with daily life, it's worth a clinical evaluation. The goal is not just short-term relief, but fewer headache days over time. If this walkthrough helped, subscribe for more calm, practical health guides. And in the comments, which helps you more for a headache, cold or heat? This information is not a substitute for medical advice.